Welcome back to Houston Live. Dealing with bad teeth can affect more than just your smile. It can really impact your quality of life and even the foods you can eat. Many think dentures are the only option to restore their teeth, but our next guests are here with a more permanent solution. Please welcome Dr. Michelle Azar from Texas Dental Implant Center, along with his patient, Lawrence Mata. Gentlemen, welcome to you both. Dr. Azar, we've had you on the show a bunch. And Lawrence, it's great to meet you. We were just chatting during the break here. You were wearing dentures for about 24 years. Since 2000.
Yes.
Describe some of the hurdles you faced wearing dentures.
You know, they weren't perfect, you know. It just wasn't what I'm wearing now. It was, I had this appliance in my mouth.
And I didn't realize that dentures, that appliance, it's actually covering the roof of your mouth.
Yes.
It seems like everyday tasks like eating foods you really love, you're not really tasting or enjoying the texture of those foods because you can't even feel the roof of your mouth.
Exactly.
But you were just putting up with that for more than 20 years.
I was putting up with it, yes.
When did you finally get to the point where you realized you wanted a change? You wanted something better? And by the way, your current teeth, I mean, they look perfect.
Oh, thanks, they feel perfect. Yeah, I think Dr. Azar did a great job. And I'm just so happy that I saw him on TV and called him and asked him to help me get these teeth.
So that's how it happened?
Yeah, that's how it happened.
Okay, so you just got to a point where you didn't want to hassle with dentures anymore.
Right.
Okay.
Right. I was just, couldn't do it any longer.
And this is such a good point, Dr. Azar, because we've had so many of your patients come on, and the before and after photos, they are so dramatic. I mean, just the visual, the look is night and day, but also the clunky nature of what your patients have been through.
Yeah.
Dentures are a pain.
Yeah, having dentures is never easy. You have to get used to glue, and they move all the time, and sometimes they produce sore spots. On the long term, from a medical perspective, it can cause bone loss because as the dentures keep moving and rubbing against the gum kind of retract away. It's your body's way to protect itself.
This bone loss is a big deal, Dr. Azar, because folks don't, maybe have options in many cases. And that's the sad thing. A lot of people with bone loss have been told by dentists or even periodontists, hey, you know what, there's nothing we can do. And that's why what you're doing, the one arch procedure, really is revolutionary, because even with bone loss, this procedure can still work.
Right. In Lawrence's case, I mean, he was fortunate that even after 24 years, we've had bone to place the implants. Some other patients that we see, they don't have any bone to place where implants are supposed to go. And in these cases, we use more advanced techniques like zygomatic implants or what we refer to as pterygoid implants. So it's all implemented into the treatment plan. And the goal for us is just to get one surgical procedure, and then the rest would be just working on the teeth in a pain-free visit.
So after that first surgical visit, then temporaries are applied, and then the final teeth, we're seeing the animation for how the process works here. Lawrence, how long did your process take from the time you went in for that first consultation? Because what I can't believe is the teeth in your mouth right now, those have only been there for about a week. I mean, you just finished this process.
They've been here a week.
You're totally adjusted to them.
I'm totally adjusted. They're perfect.
And was the process faster than you expected?
It was faster and easier than I thought it was going to be.
Well, will you look straight at the camera, straight at that camera over there? Okay, so here's the before, and there's the after. Dare I say you look younger, Lawrence?
I feel younger.
Do you?
I feel younger.
Well, one of the first things you told me today when we first met, when I complimented your smile, you told me you wished you had done it sooner.
I wish I had done it sooner.
Yeah? Why do you wish you had done that sooner?
Oh, well, I wouldn't have had to gone through all those years of having that huge appliance in my mouth.
Yeah.
You know.
And trying to eat the foods you love. What kind of foods do you like to eat?
Just everything. I eat everything.
We're in Texas.
Fish, steak,
Yeah.
take a bite of an apple.
And these
I can do all of that now.
things that many of us take for granted, Dr. Azar.
Yeah.
This is a typical response you hear from your patients, yes?
I think every patient tells me that the most food I miss is the apples and steak, because these food are generally harder to chew, especially if someone has teeth that have cavities and causing them pain, or dentures, the dentures would move. So that's the first item that every patient would tell me, actually, yeah.
the dentures would move.
Yeah, and the hassle of year after year of dental appointments, of dealing with things like dentures or other dental appliances. What's incredible is with technology now, someone can go in and with one procedure get life-changing results.
Yeah, I think technology has came a long way. Luckily, in the clinic, we had all the technological pieces or an equipment to make this process as easy as possible. So in the end, we have the patient in mind, and we want to address all the years that when they had hard dental visits, long, painful visits. Technology has helped us a lot to bring all of this in-house and get the results very predictably.
Well, it really is a dramatic improvement. You look great, Lawrence.
Thanks.
Looks like you feel great too.
I feel great. Anybody that's thinking about doing it needs to do it.
Okay.
They just need to do it.
They look perfect in your mouth. It's like the teeth you've always had.
They're the teeth I've always had, yeah.
Well, that's Dr. Michelle Lazar. Great seeing you guys.
Thanks for having us.
Yeah, we'll see you all again, and enjoy the rest of your day, gentlemen. The Texas Dental Implant Center does have a special offer for Houston Life viewers. The first 20 callers will receive a complimentary consultation after a short pre-qualification call. That consultation will include a one-on-one chat with Dr. Azar and a 3D scan and x-rays. Those are all a $1,000 value. So to schedule your appointment, you can call 346-1-ARCH. That's 346-663-2724. You can also visit them online, bestdentalimplantshouston.com. And Houston Life will be right back.